It's disturbing to me that as a country that has been at least one of the leaders in the world, that our healthcare system doesn't serve people in the way it should.
The money is all for hospital care and medical care and not for health prevention.
I know that there's so many people in this country that aren't healthy or that have unhealthy habits, and then they wait until it gets too late.
We treated people before they got sick, and same with mental health and everything. We would head off a lot of these problems.
No one should be forced to be in that situation where you have to wonder, you have to be afraid of anything happening to your children or your children becoming ill or yourself becoming ill.
I hate the healthcare system in this country.
Healthcare is the most important issue facing the world today.
Everyone would like to have more healthcare that works better at a lower cost whenever they want it.
We can't just have slogans that say we need to cover everybody, have access for everybody. We've got to have a system that works.
We need organizations whose function it is to bring about collaborations.
To engage in the research that identifies the problem, the solution,
and can really drive an agenda from thought to action.
So that in the end there is a change, an improvement.
That's NEHI. We need NEHI today.
The uniqueness about NEHI is that they have this, it's like this nucleus. I think of it is this amazing group of folks and its incredible ability to pull from them. You have the insurance companies, you have the universities, hospitals, nonprofit organizations that are bridging some of these issues, biotech, medtech, pharmaceutical companies. These people do not come together otherwise. Traditionally, it's been competitive amongst these groups.
The uniqueness of NEHI lies in the fact that they bring everybody together. They have, I really think, the first organization associated with healthcare that has all the stakeholders and interest groups at one table. How they did that is beyond me, because the healthcare world is a very fractious one, and that's one of the reasons why we have the healthcare problems we do.
We say we want to revolutionize the healthcare field, find solutions for Parkinson's and Alzheimer's, or all the big problems that are ahead of us. You can't revolutionize anything as broad as healthcare without putting people in the room. You have to really be a part of it.
I think that the collaboration that NEHI enables is absolutely essential to the passage of important policies or laws in the state.
We're not a think tank, we're an action tank. We are all about changing, reforming, improving the healthcare system.
The thing that impressed me the most about NEHI is that they not only do research to find out things, they actually do research that eventually moves something on the ground.
And NEHI has given us a real platform to help take what we know about diabetes and make it part of a statewide effort around healthy choices, healthy lifestyles, keeping your chronic disease in control.
Part of what NEHI is doing is directing our attention at issues that have not been explored fully, like our own power over our own lives. And in the year since the NEHI Boston Foundation study appeared, I don't think it's any accident that the conversation has fundamentally changed.
There's just been a whole series of issues which we've tackled where NEHI has had a major impact.
One of the most salient NEHI reports recently has been the one on computerized physician order entry. And that's something we've been talking about for years, but their thinking and their action on that really kicked the ball over the goalpost, if you will, and brought this to the attention of every hospital across the Commonwealth.
About 10% of all admissions in community hospitals experience an adverse drug event that is preventable. And the report showed that the adoption of these systems could reduce that level of errors by about 80%. And the Massachusetts legislature will adopt sweeping healthcare reform that includes in it a requirement that all Massachusetts hospitals have these systems in place by the year 2012. And that's a direct result of the work that NEHI and MTC, along with its collaborators, have done together. It's been about as successful as a project could be.
NEHI may start with the words New England, but I would hope, and I do believe, that it has the potential to really change the dynamics of healthcare policy and action agendas across the nation.
In a way, this coming year is the biggest year for health reform, potentially, in 15 years. And so the work that NEHI has done is now teed up to be part of that debate and to provide the research and background for the key players who are going to be writing the legislation that reforms healthcare in America.
What epitomizes NEHI? Partnership.
Leadership.
Knowledge.
Innovation. They are compelling.
Excellence, without question.
Visionary.
Diverse constituencies.
Comprehensive. That's what NEHI is.